I was first officially diagnosed with sleep apnea probably fairly recent, just a few years ago. I've been married for 25 years. My wife, who's an RN, had said, "I think you have a sleep problem," and it took quite a while to get around to doing anything. So the kind of symptoms that I had with sleep apnea were around, loud snoring. And then while I was sleeping, someone would notice that, my wife would notice that I wasn't breathing fairly often. So that was a real signal. And the other one that really had a practical impact is that sometimes it was difficult to focus and concentrate while I was at work, and I wasn't sure why. I was prescribed a CPAP machine, and after a number of attempts to try to use that, I just gave up. It just didn't work for me. It was too intrusive. I couldn't keep the CPAP device in my mouth. I would always take it out, and basically it just collected a lot of dust. I was referred to Dr. Yang. Obviously he evaluated me, looked inside my throat and my nostrils to see what was going on. And with this experience, it was pretty obvious to him pretty quickly what was the issue and what the recommendation was in terms of what I needed to do. Surgery was recommended, and it wasn't, quite frankly, an easy decision to make ahead of time. My wife and I went through a thoughtful process, but it was fairly straightforward, or to us at least, that it was a good idea to do surgery. The first 3 months after surgery were it's where you notice the most contrast from before and after. One of the things I noticed right away is that the oxygen uptake and the breathing was more clear. I know that sounds funny, but sometimes when you have sleep apnea, it doesn't feel like, because you're tired quite frequently, it doesn't feel like maybe you're breathing as well. But my breathing, it was like I had an oxygen tank. With Swedish, I was very delighted. From the upfront diagnosis to the sleep studies themselves, to the preparation for the surgery, the scheduling and the actual surgery, and then the post-operative, and of course at the end of the day what you care about are the results. So, was my condition fixed? And I can say that I was very, very pleased. It was very much fixed.